Mr. Chairman, thanks very much. I appreciate the work that you're doing and the Ranking Member Cassidy on the reauthorization of the Pandemic Hazards Preparedness Act. I also want to thank Senator Romney for working with us on this reauthorization. I wanted to start with Dr. Walensky, Director Walensky, on supply chains and PPE. We learned a horrible lesson in the pandemic, which, to the way I look at it, kind of a national failure when we couldn't provide the kind of PPE that we needed. We don't ever want to have that transpire again. We had a buckling of that supply chain in the midst of the worst pandemic in 100 years. It adversely impacted first responders and healthcare workers, essential workers, as you know. So I think we all agree that was totally unacceptable. One factor that contributed was a heavy reliance upon imported PPE, and the dependence upon those foreign manufacturers and foreign suppliers is what drove that. It created a terrible risk that we all know that our families and our communities paid a price for. How can we promote innovation when PPE designs are outdated, and then ensure that these innovative new technologies are always available to essential workers, and whether they're in healthcare or otherwise, especially during a pandemic?
Thank you, Senator. I'd be happy to have our team touch base with you about all the research that is happening at NIOSH now to ensure that we have innovation in PPE. One is our National Personal Protective Technology Laboratory that is working in sites like the one in Pittsburgh that looks at new technology for PPE that is used in healthcare and used in public health emergencies and other environmental hazards. That work is ongoing. We're working with academia in that work, and I would be happy to brief you and your staff on the work that's happening there. And I don't know if the ASPR had anything to add to that with regard to the...
Sure.
Thank you, Dr. Walensky. Senator Casey, just to say, the ASPR organization has invested $16 billion in 87 different contracts for domestic manufacturing of PPE and other critical supplies. But when we lose the COVID dollars, we lose our ability to do this construction authority and to continue to invest in similar projects. As we're seeing supply chain pinches, as Rob mentioned, across many different materials and products, it'll be important that we maintain this ability to keep this work going.
Well, thank you. It'll be a huge issue among many difficult issues in this reauthorization. Commissioner Catliff, I wanted to ask you a question about device shortages, which is another challenge. We know that in the midst of the pandemic, that was another significant strain. In particular, we saw a terrible shortage of medical devices. The FDA took advantage of the authorities that it had during the health emergency and required manufacturers to notify FDA of potential or actual shortages. How many devices, if you have this number, how many device shortages has the FDA been able to prevent using this authority?
Approximately 350. So it's a large number, and this authority is going to go away. We need it, and we need notification both with drugs and devices, not only when manufacturing is disrupted, but also when there's a huge surge in demand, so that we can help them make up for it.
Thanks very much. Mr. Chairman, I'm giving back a minute.